5:30, active, healthy women suffering heart attacks. The symptoms may be as simple as neck, jaw, or back pain and shortness of breath, but something you might shrug off. But Emily Reamer tells us right now, it's all a medical mystery that doctors at MGH are trying to figure out. Take a look.
So it was Labor Day, and it was a beautiful sunny day.
The kind of beach day that parents live for. Lindsay Gervino spent it with her toddler, Andrew.
We played all morning.
Just hours after taking this photo, Lindsay was in the emergency room, diagnosed with a heart attack.
It was complete shock. Complete shock.
Lindsay is young, healthy, with no history of heart disease, and yet this coronary angiogram found a tear.
It looked like, if this is your artery, that there was a flap kind of doing this on the inside.
It's not as rare as one would expect.
The condition is nicknamed SCAD and stands for spontaneous coronary artery dissection.
That is when the wall of the artery actually rips or tears open.
Doctors are still learning the causes, but they have some clues. It affects significantly more women than men, the average age around 44 years old, and it appears to occur after extreme physical activity or emotional stress.
It seems that whenever there's a surge of adrenaline to the heart, it can cause the heart to beat very strongly, and these arteries can rip or tear open.
Hormones may also increase the risk. Lindsay delivered 2 babies in less than 2 years, and she was working out that afternoon with heavy weights.
Yes, I thought, oh, maybe I just pulled a muscle. Like, you do think of all those excuses.
Even the paramedics thought Lindsay was having a panic attack.
The symptoms of anxiety are very similar to cardiac symptoms, and so that's a frequent reason when young women would go to the emergency room, they would be sent home.
Undiagnosed patients often resume their same routines.
The heart could actually stop beating or having a bad rhythm problem in that first several days of the heart attack.
Instead, Lindsay entered this cardiac rehab program at MGH to repair her heart.
They almost feel like they're betrayed by their body. Like, how did this happen?
Rehab nurses teach safer exercises, meditation, and stress management.
And that's hard when you've got 2 little babies and a husband and a job and school.
Today, Lindsay's prognosis is excellent. Her workouts have changed completely, and she tries to educate other young parents about the dangers of doing too much.
And you don't want everyone to panic like it will happen to them, but it's shocking. It's still shocking to me to say it out loud that it happened.
Doctors have not identified a genetic cause for SCAD, but the research at MGH continues. They do believe it could be linked to something called broken heart syndrome, a condition where real-life stress causes cardiac problems. Emily Reamer, WCVB News Center 5.
Take a live look over the city of Boston.